You are watching Radicon.
Wrist tendons, so there are 6 compartments of extensor tendons. If you report MRI, MSK MRI regularly, you will remember it. Otherwise, you can look it up whenever you are reporting. So extensor compartment 1 is APL and EPB. Then 2 is extensor carpi radialis longus and brevis. 3 is extensor pollicis longus. Then extensor digitorum. Then extensor digiti minimi and extensor carpi ulnaris. So extensor carpi ulnaris position can vary depending how the patient was imaged. So on your left side, you can see the wrist was imaged in supination, and you immediately think that whether the ECU has been subluxed, but in fact it's just because the wrist was scanned in supination. That's why this is the normal movement of the extensor carpi ulnaris tendon in relation to its groove. As seen in the supination, as you can see in pronation, you can see the ECU tendon is sitting in its groove, and that's where it should be. So you have to take into account how the wrist was scanned before you think or comment whether there is ECU pathology or subluxation. Here's a case of extensor carpi ulnaris tendinosis. So you get signal change within the tendon with some surrounding soft tissue thickening and reaction, which can suggest tenosynovitis. And in extreme cases, you get a bit more fluid signal intensity running into the ECU tendon. That would be consistent with a partial thickness tear. With trauma, you can get ECU subsheath or tendon sheath tears, which you get disruption of the subsheath, and that can result in ECU subluxation or dislocation, as demonstrated in this case. So there's a partial tearing of the ECU tendon with ulnar subluxation. There's quite a fair bit of surrounding soft tissue reaction and edema. There's perhaps a degree of tenosynovitis in this region as well. The Quervain's tenosynovitis is a tenosynovitis of extensor compartment 1 tendons, which are abductor pollicis longus and extensor pollicis brevis. Here is an example of the Quervain's tenosynovitis. So it's a fat set sequence, and you can see that there is a rim of hyperintensity around the extensor compartment 1 tendon. There is mild soft tissue reaction as well. So this is a case of tenosynovitis. In some cases, you may see signal changes within the tendons as well. So you can have associated tendinosis or tendinopathy with tenosynovitis. What can we do about it? You can have patient can use splints to rest the wrist. However, or if that measures fail, then you can consider injecting steroid injection or PRP injections as well.
You can subscribe to our YouTube channel and click on the notification bell for new courses. For more modules and Radiology CMEs, please visit www.radicon.org.